Welcome this week to Western Medicine on Talk 1260 KTFC. This is the Humanity Behind the Vanity. I'm Dr. Daniel Ronel, plastic surgeon, here with my wife Betsy.
Hi.
This week we got a new sponsor this week. Artifil is our sponsor, and then there's a new one, iFlow, the makers of the ON-Q pain pump, the
They're
pain buster.
fantastic.
Yes, they're great.
We'll
talk about that some other time.
Okay, they're excellent. All right. So let's introduce our show. We have an amazing guest today, one of the superstars of Santa Fe. Her name is Lauren Parrish. She's the founder and owner of Body of Santa Fe. And they are just forerunners in the green movement in terms of face care, food, clothing, everything. I mean, I've tried to get Elle Magazine to do a story on her, and I know it's in their little boiling pot. So one day it will happen, but I mean, she is noteworthy and totally cool.
Yeah, I look forward to talking
So we're
to
so
her.
psyched she's going to be here. We also have our spiritual tip of the month by Scott Thomas, PhD.
Right, our
I'm looking-
psychotherapist.
Yeah, I'm looking forward to that.
Yep.
And then we're going to talk about nose jobs, rhinoplasty for the big doctor.
Okay, I did one the other day, and so that's why we're going to talk about it.
Are we talking about it now?
I don't know, you want to?
Okay.
Fine.
Why not?
A lot of people come to me wanting a nose job. Things have changed in the past couple of decades. Even when I was in training a couple, years ago, we really wanted to make a very refined nose with the bridge of the nose lower. Nowadays people are saying, maybe it's just in New Mexico, they don't really want to change the ethnicity of their nose. They just want to make
That's
some...
universal. People with an ethnic awareness.
Well, we do hear a lot about people like African Americans who try to have an Anglo nose, or Asians, right? And I think really that's a lot of media hype, because most of the patients that I see, they want to keep their ethnicity. They just want a little bit of refinement, like somebody who has, for example, the combination of a Native American and Hispanic nose is called a mestizo nose.
Right.
And
local terminology.
Yeah, it's got a droopy tip, sometimes a wideness in it. And what many of people ask me is just to make it lift the tip a little bit, just make it a little thinner, but not to make a dramatic change. And I welcome that, because making a dramatic change is difficult.
Yeah, it can have really screwy results.
Yes,
Yeah.
yes, absolutely. So this one this week was an Anglo woman. She's from Connecticut, actually.
Oh.
She's moved out here. And she had a dorsal hump, which is a really common thing.
That's typical. I had one.
It's a bump. That's right, when you were a teenager.
Right. So ugly on me.
A bump on the tip of the nose, and she just wanted that taken down.
Right.
The, quote, aesthetic ideal, which is devised from a bust of Nefertiti, actually, from I don't know, 1000 BC, is if you draw a line from the point in between the eyebrows to the tip of the nose, it's called the radix, to the tip of the nose, the aesthetic position of a woman's dorsum is 1 or 2 millimeters below that. Whereas in a man, that's a very feminine thing. So a man's bridge needs to be on or somewhat above the line. So when you take down a dorsal hump, sure, the aesthetic ideal is to take it down below that line in an Anglo person, not in
Another
someone
ethnicity.
somebody from New Mexico, for example. So and she didn't want her tip touched, and she wanted her nose thinned a little bit. Oh, also, that's right, her septum was deviated. She was deviated to the left.
Oh yeah, you talked about this case.
And those are always a bit of a
yeah,
challenge.
you thought it was going to be a very serious operation, and then you
Yeah.
said you opened this patient up, and it was much easier.
Yeah, what happens is the cause of nasal deviation is so varied. There's so many different causes, and
It's what all the movie stars use as an excuse. I had a deviated septum. Right. Whatever.
Okay.
You wanted your nose fixed. Big deal. Okay.
So anyway, in her case, fortunately, she didn't really have any warped cartilage or any extra bones. It's for some reason the attachments of her nose to the septum caused it to deviate. And
Did she ever get hit in the nose by even a nerve ball or
not that she
anything?
remembered.
Okay.
And so when I just opened everything up and loosened everything, it straightened out by itself, which was
Oh, she's
really
lucky.
nice,
Yeah,
right? So I
and you're
didn't have to
lucky.
do.
Yeah, that's nice.
I didn't have to do a big job on her.
Yeah.
And this is interesting. The nose is like a tent. It's got 2 walls. And
Don't
then,
get too specific. You're on the radio.
Okay, fine.
Okay.
Anyway, if you can see us on YouTube,
Yeah.
it's like a tent. And when you take the dorsum down, when you take the top of the tent down, often you're left with a very wide nose. And if you're a little green man standing inside the nose and you look up, you can see the sky. That's called an open roof deformity. So often, when you just try to take the hump down, you actually have to bring in the sides of the tent. You have to do an infracture.
What if you just
And
didn't
that's
take
called-
it down that much?
Well, then that can happen, and
That's what happened to me.
right, and that just means that you don't have a very big hump. There's some people who have a really big
Oh,
hump.
of course, that's, yeah.
And another thing is sometimes the hump is made out of cartilage, sometimes made out of bone. So the point is, after you take down the hump, then the surgeon has to assess whether there's an open roof, a broad dorsum, and if
then
there
it'll
is, then you
collapse.
got it right.
Yeah.
Then you got to infracture, and that's really what breaking the nose is. And it's not as dramatic as you think.
I thought they
It's just a
broke
little
noses
subtle.
every nose
No,
job.
no, no.
They broke my nose. I keep talking about myself, people, not because I'm a total narcissist, a little bit, yes, but mainly
It's a
because
good
I'm using
example.
myself as an
Right.
example. I'm
Right.
totally honest about what I've had
You
done.
probably did have what I did when
The
you
open
took
roof.
when you took your hump down.
My dump?
When you took your hump
Okay.
down, you had an open roof, and that's
Oh,
why
okay.
he infractured it. And it's not a true quote breaking of the nose like when you have a trauma in a car or
We've
somebody
all,
punches
if
you.
any of us have watched those plastic surgery shows, we've heard that
Yeah, it's a
when
little
you break
tap,
the
tap.
nose, it's
Right.
gross, okay.
Okay, and that's dramatized on TV because when you do it in the OR, it's very, very controlled, and I'm telling the nurse tap, tap,
I
tap,
know,
tap.
we all know that
or
too, because we've all
Fine.
seen those shows,
All
okay.
right.
If
So
you
anyway,
haven't,
I haven't seen them. So anyway,
Okay.
so that's the story. It's an infracture that happens. She had, I had started her in arnica beforehand. She got some oxygenation treatments.
How was her bruising
So
after?
it's only been a couple days, so I don't know.
Oh,
But
okay.
the
Has she
last
called
couple,
to give you an update?
no, the last
Oh, she
couple
must
I've
be
done.
totally fine then.
The last couple I've done, I have not had significant bruising. That doesn't mean you're not going to have it, but
No,
that's
it just
what
depends
happens.
on you. I had my nose fixed when I was like 27. I had very minimal bruising and none of this arnica. I didn't know about any of that stuff. It
Right.
was just an
Well, you also had a
old-fashioned
very
nose
good
job.
surgeon.
I had an
Dr.
excellent
Wiener in New
surgeon.
York,
Right, he's excellent.
Very nice guy. All right,
Excellent.
we got to wrap this up. What's coming up next?
I don't know, I also am very excited because my good friend David Evangelista, style guru, we all know him from Rosie O'Donnell's show, he is coming to Santa Fe for a family wedding and I will steal him away from his Italian family to
Okay.
make him my own. I am so excited. Anyway, okay, so
You're
shout out to
listening,
him.
you're
No.
listening to Talk 1260 KTRC, Western Medicine. We'll be right back with a spiritual tip from Scott Thomas.
That